last 5 years, the Johns Hopkins Sheikh Khalifa Stroke Institute has been working to improve life after stroke, using innovative clinical care, creating novel technologies, and shrinking the gap between research and treatment. And I'm so proud of the extraordinary people and partnership that have made this possible.
The night I had my stroke, I was terrified. I remember thinking that I have to fight for my life.
The first minutes to hours after somebody has the onset of symptoms are really the most critical in terms of enhancing recovery. At the Sheikh Khalifa Stroke Institute, we are learning not only new ways to prevent and diagnose stroke, but also new ways to treat acute ischemic stroke. For example, my team has developed new, really exciting imaging techniques looking at areas of the brain that are dysfunctional that can be salvaged by pulling out the clot. We're already in the clinical stages of expanding the window to 24 hours or beyond. And the Stroke Institute has just completed a randomized clinical trial of transcranial direct current stimulation. We've found increases in naming and increases in spelling. If you can restore someone's language and speech, it really brings them back to who they were before the stroke, and that's just, there's nothing better.
I was in the hospital and could barely move. I was thinking I would do anything to just be able to walk.
Is there anything you need while you're here?
Our mission 5 years ago was really to transform hospital care into healing care for stroke patients, and we've done just that.
Just try to move your arm around and see where he swims to.
Chronic neurological conditions are complex, so you have to match their complexity with a complex intervention. The SKSI philanthropy allowed us to build, for example, super rooms where we have full immersive, holodeck-like experience.
That really motivates the patient at an emotional level to achieve high levels of activity, motor activity as well as exercise.
But we also realized that one area that is hugely deficient for stroke patients is the hand. And so we've now developed this training game called No-No, which particularly targets dexterity. And the development, it was completely due to the infusion from another SKSI. No-No will have a first pilot trial very soon, but right out of the gates, a small pilot trial with the dolphin, it proved to be twice as effective than just a regular rehab. This is just the tip of the iceberg. We've just begun.
Little things really give you hope, because then once you get through that one step, then you know that you can go further.
At the Sheikh Khalifa Stroke Institute, we want the journey for the patient to be seamless. That is why we've been building the continuum of care model of recovery and rehabilitation. When a patient leaves the inpatient service, they immediately come to the outpatient path programs. To help patients regain movement and function, we've designed the bimanual arm trainer, where even a patient who is completely paralyzed on one side could still perform the most critical movements of the upper arm. And that's quite life-changing. The second gap we have to address is muscle stiffness, because the sugar molecules inside the muscles congeal together and become stiff. So one of our clinical trials involves using the enzyme hyaluronidase that dissolves this sugar molecule and facilitates movement. The most fulfilling part of my job is to really see my patients come back and do things that they couldn't do before.
The impact of the Sheikh Khalifa Stroke Institute goes well beyond Baltimore, the United States, to Abu Dhabi and the rest of the world.
We've established a community of practice to drive standardized education, protocols and standards, and functional outcome measures, which drives improved outcomes for the patient.
We also are working with an AI-driven platform to detect intracerebral hemorrhage in CAT scans, which will allow us to geomap the number of hemorrhages in a particular place and to target public health interventions.
Next, specifically in Abu Dhabi, we are working on 3 interventions. One is non-invasive brain stimulation. The second is a next-generation hospital room to facilitate a patient's activity and mobility throughout the day. And the third is remote video and analysis to support clinicians in analysis of motor deficit.
We're looking forward to continuing this work, taking stroke care to the next level.
In the last 5 years,
We have developed new, really exciting techniques.
Especially in the area of neurorestorative treatment.
We created the stroke unit of the future.
and it saved my life.
What began with a generous gift from the government of Abu Dhabi 5 years ago, the largest gift ever designated for stroke specifically, has meant revolutionizing the care for stroke patients in the US, the UAE, and countless other countries around the world. With this tremendous foundation, the next 5 years will bring even greater discoveries, innovations, and treatments for our patients.